Good morning, everyone. Good morning, Houston. Thanks the organizers for inviting me here for addressing this critical topic. Also thanks to my team in Murcia and Barcelona, and our global collaborators, particularly Texas, Mount Sinai and Dr. Mark Miller and Metanayer. I am Dr. Juan Antonio Ortega, leading the long-term environmental and community health follow-up program at Hospital Virgen de la Rixica, Murcia, Spain. Landing on the moon was once an impossible dream. Today, redefining childhood cancer care through a planetary health approach is our next frontier. Together, we are shaping the future of childhood cancer care. Today, I am here to share with you the innovative work we are doing in Murcia. Our approach integrates the principles of planetary health into pediatric oncology care. This journey takes 5 key stages. 1. Region of Murcia, the context. 2. The foundations. 3. Our tools and innovations. 4. Results and impact. 5. Expanding globally. Let's take off and explore together. Region of Murcia, the context, setting the stage. Murcia is a small Mediterranean region in Spain. With a Roman and Islamic rich culture and agricultural heritage but also faces significant environmental challenges, including the degradation of the Mar Menor, a polluted saltwater lagoon due to agriculture runoff, urbanization, and industrial activity. 20% of the population are immigrants from North Africa and Latin America, and 30% of children living in poverty, making public and environmental health initiatives more critical than ever. Despite these challenges, Murcia is home to Hospital Virgen de la Rixica, Spain's largest maternity hospital and the regional reference center for pediatric environmental health and pediatric oncology. The healthcare system in Spain is decentralized, universal, and funding by taxes. This means every child, regardless of background, receives cancer treatment free of charge. In Murcia, we diagnose approximately 50 new cases of childhood cancer at year. Survival rates stand at 85% at 5 years, similar to global benchmarks. Looking at the map, we see key challenges. The Mar Menor's ecological crisis. Industrial hubs, such as Spain's largest oil refinery and Europe's biggest bisphenol A plant. And intensive agriculture and high-exposure tobacco smoke. This overview underscores both the challenges and opportunities that define our region's environmental health landscape. The foundations of our program, building the spacecraft, core structure. Since 2003, PEHSU-Murcia has been integrating environmental health into clinical practice, with a special focus on pediatric oncology. Every child diagnosed with cancer is referred to PEHSU for environmental assessment and long-term follow-up. Our team includes environmental scientists, environmental health technicians, family doctors, environmental midwives, environmental nurses, and pediatricians. Currently, Spain has 3 PEHSUs, Barcelona, Olot, and Murcia, and we aim to expand to 15 by 2030. PEHSU-Murcia operates across several areas, from clinical consultations to community programs. But today, I want to highlight our environmental and community health program for long-term follow-up of childhood cancer survivors. Our approach. We follow an anticipatory medicine framework, where primary, secondary, and tertiary prevention are perfectly integrated. Anticipatory medicine is not just about acting before a problem appears. Even after diagnosis, there are always opportunities to improve outcomes. Every small step matters when our goal is long-term well-being. The sooner we start, the better. 2 strategic pillars in our program. The first, education, healthy lifestyles and environmental health, promotes co-responsibility, self-care, and environmental awareness. The second pillar, screening and early detection of late effects. We integrate environmental risk assessment with international clinical guidelines. Together, these pillars create a sustainable and holistic model for survivorship care. This is our strength. What makes this program successful? In my opinion, the trust is the key to success. We have gained the trust of families. Today, more than 1,000 families from 1998. Why is sustainable? Networking. We work together, PEHSU team, pediatric oncology, and 85 primary care centers. Finally, how long does? For life, truly, as long as they want. I would be great following the children of patients, to know the effects in the next generation. Tools. And now, it's time to explore onboard technology, the key tools driving our impact, pediatric environmental history. PEHSU is the core of our survivorship care. It is a simple, modular, and adaptable tool that integrates environmental health into clinical practice. It helps create robust information systems for survivorship care. It is a modular structure. White heavy checkmark at diagnosis, the green page detects risks early. White heavy checkmark during treatment, risk assessment personalizes interventions. White heavy checkmark at the end of treatment, the green passport structures follow-up. White heavy checkmark long-term, it connects primary care and survivorship monitoring. Advantages. I want to highlight 5 key advantages. It provides holistic, personalized care. Is fully embedded in clinical history, supports anticipatory medicine, is scalable for different health systems. Green page. At diagnosis, we start with the green page, a simple but powerful tool that takes just a few minutes but has a lifetime impact. It collects key data, environmental and lifestyles, identifies modifiable risks, and contributes to cancer epidemiology research. Every child with cancer, anywhere in the world, deserves this basic yet essential screening. Carbon footprint. We need new indicators that integrate climate change into clinical practice. I strongly believe that individual carbon footprint tracking will become universal, especially for chronic patients, helping to monitor progress over time. White heavy checkmark. Since 2022, we've included carbon footprint data in every clinical report. White heavy checkmark. This promotes healthy lifestyles and environmental health. During treatment, we empower families with self-care tools to improve outcomes. Guardians de la Salud Planetary app helps monitor environmental risks and providing real-time recommendations. Also, supports clinical decision-making by integrating data into follow-ups. This tool has 2 goals: improve environmental health and reduce treatment-related mortality. Innovative tools. I would like to talk about these 3 tools: the Green Passport, collaborative digital platforms, and EducAdventures. The Green Passport. The Green Passport for structured follow-up. It is an expanded version of the International Clinical Guideline Survivorship Care Plan. On the left, you see the key components. Nearly 50% of the content is dedicated to environmental health, helping survivors reduce chronic disease risks. Every survivor receives this passport at 5 years, ensuring individualized risk assessment, linking them to primary care team with tailored recommendations. The Green Passport is a cornerstone for preventing chronic diseases. Also, it is a bridge with Planetary Health, offering a personalized roadmap to lifelong prevention and health resilience. Agora is our digital platform to connect stakeholders, that perfectly connects hospitals with primary care providers. It ensures sharing information in real time. EducAdventures is a new model of clinical intervention designed to integrate nature into pediatric cancer survivorship. White heavy checkmark. Our goal is to empower survivors, turning them into educators, expert patients in environmental health. White heavy checkmark. We are studying its effects on the neuroendocrine system and inflammation markers. Results and impact. Mission success. Now, let's see the real-world impact, how this journey is transforming survivorship care.
Let's see the real-world impact, how this journey is transforming survivorship care. Aspects we are most proud of is the leadership that we've built within our community. With 85 primary healthcare centers across Murcia actively participating in long-term follow-up, ensuring decentralized, equitable healthcare for all children. During the last 10 years, we have carried out short training and workshops for primary care, families and communities. The majority has been face-to-face. Transforming pediatric cancer. We are transforming pediatric cancer care. Survival rates have reached 85% at 5 years and 80% at 10 years. Murcia model works. We identified the first preventable modifiable prognostic factor in leukemia, tobacco smoke exposure. It was later expanded by the Metanaya team. This effect seems to be related to mortality associated with treatment. This is just the beginning. Now we can explore more modifiable prognostic factors to improve survival and prevent chronic diseases. Long-term environmental health outcomes. Our program improves quality of life in childhood cancer survivors by addressing modifiable risks. Tobacco exposure at diagnosis dropped from 50% to 17%, and smoking prevalence remains under 7%, far lower than general population levels. They have half the overweight obesity prevalence compared to healthy peers. Pesticide and chemical exposure have decreased significantly thanks to education and intervention. Cardiovascular health and chronic disease prevention. Cardiovascular complications are one of the most serious long-term risks for survivors. However, while data reports higher rates, in our cohort, the ventricular dysfunction is only 1.55%. This suggests that our early interventions and risk mitigation strategies are working. Okay, we need more studies, but our preliminary predictive models highlight that modifiable factors like diet and physical activity play a key role in preventing this chronic disease. Policy and environmental health impact. Our GIS-based environmental monitoring system allows us to track pollution, pesticide use, and other hazards that impact children's health. Through this system, for example, we identified cancer clusters near industrial zones, including a bisphenol A plant. This article was published in Environmental Research. Our findings had a major impact on public policy, leading to increased environmental regulations. This is a crucial step forward. Action research. Linking etiology, prognosis, and prevention. Integrating etiology, prognosis, and prevention, making environmental health a key component of clinical practice. On the right, poor air quality perception in our families after diagnosis correlates with worse survival outcomes. On the left, our collaboration with Rebecca Ramis identified an air pollution threshold during pregnancy linked to childhood leukemia. Our holistic, patient-centered model includes opportunities to improve before, during, and after diagnosis. Expanding globally. We've reached the final stage, beyond the horizon. Our journey doesn't end here. The real impact requires global collaboration. During the last 20 years, pediatric environmental history has been the cornerstone. Now it's evolving into a new tool, Ambiomic Health Compass. Ambiomic medicine is a holistic approach to clinical practice. By merging pediatric environmental history data with AI-driven exposome genome integration, we create a scalable global framework for pediatric oncology. Ambiomic medicine expands precision medicine. To respond to this new paradigm, we need international collaboration. We can build a new global standard. PEHSU-Murcia began in 2018 as the first step in the internationalization of the Murcia model. It connected scientists and clinicians, integrating environmental risk assessment through the pediatric environmental history. Now, we move forward with PEHSU-Murcia 2, Ambiomic Health Compass, leveraging AI-driven exposome genome integration to improve predictive tools. Upcoming Europe project calls will expand global partnerships. This is a dream, but it's also a plan. In 2025, in Spain, we are networking and preparing to submit a groundbreaking European proposal, bringing together all of us. Recently, I joined Hospital San Juan de Déu in Barcelona, an institution that I see as the lighthouse we need to coordinate this vision and truly go beyond the horizon. Imagine a cohort of 20,000 children with cancer and 20,000 controls working all together. A revolutionary initiative to push survival rates above 90% at 10 years, while closing the gap for low-income countries. All children with cancer on our planet have the right to a carefully designed and personalized pediatric environmental history. This is my invitation to you. Let's work together to expand this vision worldwide. In 2025, I will submit a revolutionary proposal to Europe, and I need you to be part of it. Thank you, Houston. Let's make this happen together.